Good afternoon. My name is Paul Edwards in the Governor's Office, and we're grateful that you can join us for today's daily briefing. Today, the Governor will be accompanied by the Utah Superintendent of Public Instruction, Syd Dickson, and we'll have the daily report from Utah State epidemiologist, Dr. Angela Dunn. Governor Herbert.
Thank you, Paul, and thank you all. As always, we appreciate the opportunity to address the state, and for those of you here participating, we thank you for your participation. We continue to battle the COVID-19, the coronavirus, and it's a battle that's acute, but I think the numbers show that we're winning, and that's good news for all of us. I think the trends are good. I think the information we have and the data shows that what we've put in place is in fact working well. Again, I'd like to just say thanks to those who are on the front lines of this effort. There's many people out there. Certainly our healthcare professionals are doing a great job out there. Those on the front lines of economic livelihood, again, doing what they can to keep our economy afloat and prepared for the revival of that economy, which is going to happen, I'm sure, in a few weeks to 2 or 3 months, that we're going to see some recovery as we follow through on our plan. And so we appreciate those. The Department of Workforce Services, again, that is helping employers and employees with their needs. Again, we hope that people would look to the Workforce Services for their help. Unemployment insurance, we appreciate the Congress stepping up and adding more money. Unemployment insurance now has gone up by $600 per week in addition to what you normally would get. So that's going to help people survive this difficult time economically for employees. Loans that are available now for the business interests, for entrepreneurs, for those to keep their businesses afloat and keep employees employed. So it's a win-win situation. We appreciate the work of our local banks and working in conjunction with the Small Business Administration. And last but not least, certainly want to thank a lot of our social nonprofit organizations, our faith-based organizations, which are helping people cope with some of the emotional stress and some of the challenges that we face in this very unusual and difficult time. So it really is it's a team effort, meaning everybody is on the team and everybody has a role to play. And I appreciate the fact that everybody's doing a very good job and committed to making sure that Utah not only survives this pandemic, but comes out on the other end and able to thrive and grow to the position of prominence we've had before the pandemic occurred. A couple of points of interest that might be of interest, at least to the public at large. Some of the things that we see out there are not just happening by happenstance. They are actually planned. They've been done because of a lot of people working hard. And one of the areas I've been most appreciative of is our National Governors Association, with all the 50 governors, including the 5 governors of our territories, working in concert, saying what are our unique needs in the respective states. We have a weekly, if not bi-weekly, opportunity as governors to speak with the president and the vice president. Once a week we meet on conference calls with other governors through our chairman, Larry Hogan, and our vice chairman, Andrew Cuomo from New York, Larry's from Maryland, and have opportunities to discuss about what we need as states to help us. For example, one of the common reoccurring themes has been block grants, flexibility to the states, because we do have unique situations. They're not all the same. Some are more urban, some are more rural. Our cultures, our demographics are not the same. And so we've made sure through the National Governors Association that the administration and the Congress understands that the one-size-fits-all mentality that permeates Washington, D.C. is not something that will work with this pandemic as we try to come out of it and address the unique situations of the respective states. So again, we've had the opportunity to speak not only with the President, the Vice President, but Secretary Mnuchin, Dr. Fauci and his staff as we've worked on putting together plans to help us stop and slow the spread of the coronavirus. And as we've also made known, unlike most states, Utah does require our legislature to work together with the executive branch to accept federal funds. And so I appreciate the fact that we've had these monies now are coming to our state. The legislature is calling themselves into session. They'll be working with us to address the budgetary issues of not only 2020, but 2021, and working together to be able to utilize these federal monies that are coming to us with flexibility so we can pick and choose some of the places where the money should go. Some not as much flexibility as we like, but we appreciate the fact that there's been at least a recognition of block grants and the uniqueness of the states and giving more flexibility. So I look forward to working with our legislature as we accept those funds and get them dispersed to those who are in need. Last but not least, let me certainly mention the ones who really are the heroes out there as our citizens of Utah who are abiding by the rules that we've put in place. And we know that this is not easy. It's disruptive, certainly to our economy and how we normally do business, how we normally socialize. And so we recognize that it's a challenge. But for those who are making sure they do their part by following the rules of social distancing, making sure that they wear masks when is appropriate. Again, we would recommend again to people that if you go to a grocery store, retail outlet, wear your mask. That helps protect yourself and protect others. Makes people feel safe. It allows the businesses to, in fact, prosper and grow as people will go there because they feel safe. And so wearing a mask extends that kind of safety to the people who come into the store to shop. So please, all of you, go the extra mile for at least a while longer of wearing masks. And if you're not wearing them, you should wear them. Let me just move into the next part here. Again, as we look at the data, we see evidence that our efforts are making a difference. That we appear to be keeping the virus from spreading. I think you'll get some information from Dr. Dunn a little later here today. You'll find that our new hospitalization rates appear to be trending down. Our new cases are trending down. I know that our mortality rate we have in the state of Utah is 0.8%, which is too high. We have, I think, 19 deaths now in the state of Utah, but our mortality rate is 0.8%. The national average right now is about 4%, and the international average is about 6%. So at least in relationship and comparison, we are doing much, much better. And we want to do even better than we're doing now. And again, I appreciate the fact that we've got on board of our social distancing and things early on. One of the early things that we did, as you know, was to stay safe, stay home directive and restricting travel to just that which is essential. And we appreciate, again, people who have been abiding by that. We also worked with the Utah Department of Health, as you recall, and we stopped and banned in-person dining, in-house dining at our restaurants. That's helped us, and we've also extended our directive that we have in place until May 1st, and we want to make sure that those two work in concert, so in-house dining continues to be forbidden, at least until the end of this month, at actually May 1st. So those will be working in concert, and then we'll take a review of that and see if there's opportunities for us to make some adjustments. Another one of the first steps we did was to, in fact, close our classrooms in what we call a soft closure, meaning that people could not go and other than to pick up homework, some pickup of foods for those that are in need. We call it grab and go. That's continued to function well. We put that in place on March 13th, just over a month ago. And even though we had a physical closure, as it were, learning continued. We did not mean the end of learning. There's distance learning, and people have been doing homeschooling. Parents have had extra challenges of teaching as well as other responsibilities they have in the workforce. We know it's been difficult. And we appreciate the fact that a lot of people are adapting and are innovating, adapting to the circumstances and then finding creative ways to make it work for your unique family circumstances. And it's not only been for families doing that, but it's certainly been for teachers having to adapt and innovate too. how they can keep in touch, social contact with their students, making sure that they get the homework, and that the homework is being done, that they get their papers corrected, and that they learn in the process, even though most of the time is spent away from the school. Our student counseling, giving emotional support, again, not being able to meet with them face-to-face necessarily, but being able to do long-distance counseling. And again, continue to make sure that people had food, those who are in need of making sure they had a meal or two during the day. That's continued. Now, we know there's been kind of trial and error. It hasn't been perfect. Mistakes along the way, and we've learned along the way, and we're in a pretty good place right now. And I appreciate the creativity and the resilience of all those involved, and particularly our teachers who've had to, not only do they have to find ways to teach their students, but most of them have children of their own that are home. And so they've had to juggle both the parenting aspect as well as the teaching aspect to our students. So it's a challenging time. As you know, we previously have extended this soft closing till the end of this month. And so I've had the opportunity to meet with a school board and Chairman Mark Huntsman, as well as our superintendent, Syd Dickson, as we've had to wrestle with the idea of, do we bring our students back into school, or do we continue with this soft closing? And after consulting at length with the stakeholders, we listened to parents, we listened to teachers. There's a variety of different opinions on what we can do or should do. I've come to the position that in order for us to continue to slow the spread and to get back on our feet socially and economically, this is not the time to have our schools back open. Again, in those crowded rooms that we have and our young people. So in order to continue the slow of the spread of COVID-19, I believe, and we believe, that based on our review of the data that we have today and our best practices that we have in place, that we need to extend the soft closure of our public schools through the remainder of the school year. This is not an easy decision to make. We know it's, again, hard, it's disruptive, it impacts not only our children, but it impacts the parents and families and impacts livelihoods. But we want to make sure that even though we're going to have the soft closing, that even though it has an impact on learning, we want to make sure that learning continues. And so learning and achievement must continue, and we want to make sure that that will continue. And so I'm going to invite Superintendent Syd Dickson, who's here with us today, to address some of these issues of what we're going to do. We're concerned about making sure that learning continues. I'm very concerned about our seniors in particular in high school, who when they graduate are college and career ready. We want to make sure that that continues, even though there's been some deficiency maybe in their learning opportunities by not being able to come to a brick and mortar school. And how are we going to help fill that gap? And Superintendent Dickson will give us some ideas of what we can do as we move forward on this issue. So again, we appreciate everybody's support. I think everybody understands the challenge that we face and the reasons for it. But let's invite Superintendent Syd Dickson, Superintendent of our Public Schools and Education and Teaching. Come on in. Syd, we'll give the microphone to you.
Thank you, Governor Herbert. First, I want to thank Governor Herbert. I know that this decision was not made without some deep thinking and consideration for our students, our families, our teachers. And he did so by consulting with many people, including our health department, who has the statutory authority to make these decisions around health issues for our state. I appreciate that Governor Herbert consulted with me and with Chair Huntsman, and that we could talk about the way forward. We've been thinking about this situation in terms of 3 phases. The first phase, you've heard Governor Herbert address, and that's really what we're calling the new now rather than the new normal. Nothing's normal about this situation. So in the new now, we're focused on the 5 things that you heard Governor Herbert talk about, which are making sure that our students are fed, making sure that we continue on with learning, making sure that our students who are ready to graduate can do so and be able to transition into the workforce and into higher education. We're also very keenly aware of the social and emotional needs of our educators and our families and our teachers, and wanting to make sure those needs are met, so our school counselors and mental health workers are working on those issues as well. And last but not least, we want to make sure that our employees can stay employed with gainful work and be paid. Many of our classified employees, our bus drivers, our paraeducators, they've been placed in roles that they haven't been in before, and we so appreciate their flexibility. As we move from the new now into the near future, which is phase 2, we have to really assess the gaps that our students find themselves in. So we have achievement gaps. We know, especially amongst our students who are vulnerable for academic failure, and those are our students with disabilities, our students who are learning English, many of our students who live in conditions of poverty, and wanting to make sure that they have the tools and the skills and the knowledge to catch up with their peers. And this will take some additional support through a transition time, whether that's summer, depending on when we can get back together and engage in small group work, individual tutoring, some digital options, or whether that comes together in the fall. We also know those social emotional needs are important throughout this transition time. In phase 3, we talk about the new future, and this is a period of time where we take pause and reset our baseline by using some of our assessment tools in formative ways, again, to see where our students are at in terms of achievement gaps, what they need to do to catch up. And it's a time to really reflect and say, what have we been doing that hasn't been working? What have we learned from this situation that we can do a better job of? Certainly, we've heard from parents who felt ill-equipped at this time to engage in digital learning. We know that we can do a better job in supporting our parents in the future with digital tools. What kind of professional support do our teachers, our educators need? I'm really pleased in our state that we've had a digital teaching and learning initiative, which has enabled many of our students and teachers to get a leg up on some of the digital delivery that many other states perhaps haven't engaged in. So while we've had some advantages, we also know that many of our students have disengaged. And we want to make sure we give every opportunity to each of our students to be prepared to transition to the next level. While we know from our students and our parents that they are missing out on possible rituals that they've really been looking forward to at end of year, I support the governor in making this decision based on the safety, not only of our students, but of our citizens. Schools and the economy have to go hand in hand, and while we want our students to be safe, we want our citizens to be safe as well. And we want to be able to get back to school. So I want to thank our students for being resilient. I want to thank our teachers for being so creative and dedicated and hardworking. And I want to thank our parents for being flexible. They carry a heavy load trying to be teachers, breadwinners, supports to their families. And we just want to thank everybody who has leaned in to continue on in this new now as we move into the near future. So thank you.
Before Superintendent Dickson leaves, she's in the middle of a virtual conference, so she's got to excuse herself to come here. But if there are any questions that anybody would have regarding the school soft closure continuing till the end of the school year, any questions for Syd before she leaves, now would be the time to ask them.
Yeah, Superintendent, you mentioned that you are concerned about the social needs of the students, but if the kids can't meet and socialize, what can you even do to kind of get them back to maybe socially healthy if they can't socialize at all?
It's a great question, Paul. If you follow social media, you've seen some of the wonderful ideas that are happening out there. Teachers are engaged in virtual recess, for example, so that students can see each other face to face. We've had drive-by parades of teachers waving at their students, finding ways for students to chat with each other. It's certainly something more common for our older students, where they're used to conversing through their devices, not so much for our younger students. So teachers are engaging them in ways to associate virtually, excuse me, phone calls. We know that teachers have been making phone calls, counselors have been making phone calls, but that face-to-face with their peers is definitely the thing that they miss, and they're always so excited to get a note or a call from a teacher.
Other questions for Superintendent Dickson?
Thank you for that question, Courtney. I think that's on everybody's mind. Our leaders, our system leaders from our charters and our districts have already been planning on virtual graduations should this day occur. And I've heard about a lot of really great ideas. I hope that students will think of some ideas as well and let their school leaders know about some of their ideas. They're some of our most creative talent. I viewed a video recently from our student body presidents, and if you haven't seen it on social media, it's amazing, where they're providing us as adults with hope and their peers with hope. So I know that our kiddos can lean in with their school leaders and come up with ways that they can celebrate their many accomplishments. We also have allowance in the summer for some of our graduates who may be trying to get a certificate in career and technical education in one of those areas, and we have ways for them to catch up with an assessment like an ACT or an AP test. Some of those things have been postponed, as well as some of the certifications that they can gain. So even though they may not have that ritual of face-to-face graduation and they can move into a virtual graduation and celebration, there are also things that they can engage in after that specific graduation date that helps them transition to the next phase.
One last question for Superintendent Dickson.
Yeah, Superintendent Dickson, what are you doing as far as making sure that students are actually prepared for when they do come back to school in terms of those assessments, letter grades for classes, things that they may or may not be participating in virtually?
Great question, Ben. Those are the very things we're talking with our system leaders about, both yesterday and today, and talking to them about options for pass and incomplete rather than pass-fail, or using third semester grades as the higher of two grades. There are a variety of things, but we're saying do no harm, go easy, realize the stress of this time. We're so appreciative of the teachers and students who are working hard to ensure learning continues, and the parents, but we also realize that there are a lot of mitigating circumstances. So thinking about a lot of creative and different ways for grading, credit, and graduation.
Thank you, Superintendent. We appreciate your good work, and I know that you're challenging times, but we're all in it together, so we appreciate your leadership on this very much. Let me just mention to those who are listening, again, if there are other questions that you might have regarding our education system, what's taking place in my office, which is 801-538-1000, Constituent Services, you can access Tammy Pfeiffer, who's my education director, and her assistant, Karen Peterson. Tammy Pfeiffer and Karen Peterson can answer any questions you would like to have and follow up, so feel free to do that. Before we bring on Dr. Dunn to give the statistical report, is there any questions for me before I leave? Sonia?
Hi, Governor. I wanted to get your reaction to a bill that was released today for the upcoming special session that essentially kind of limits the governor's power to take executive action during a pandemic and requires the governor to consult with the legislature before doing that. What's your reaction? Do you think that's a good idea?
Well, I haven't seen the bill, so it's hard for me to comment on something that I only hear about in concept. And as I understand the concept, as I've been told about it, again, that we'll have to wait and see what's in the writing in the bill, is that the executive branch, I think the legislature would just like to know what we're doing and give them a heads up. Clearly, there's a separation of powers issue here between what the executive branch can do and should do, as opposed to what the legislature has the ability to do by meeting together in a body and passing statute. They certainly have control of the budget, and that's their number one and primary responsibility. My job is to execute, and some of those emergency powers given to the executive branch, we have to execute in a hurry. And clearly, as we've seen with this pandemic, as it's arrived so rapidly, we've had to take some actions very quickly and make some decisions by executive order. So I have no problem with trying to communicate and give FYIs to the legislature, but we need to make sure we keep those separation of powers in the correct balance.
Hi there.
Hi, Amy.
So, Governor, I'm sure you're aware that there's states on the East Coast and states on the West Coast that are forming pacts to determine when to open the government. And restart the economy. And I wondered where you stand on this.
Well, let me look at it maybe in two different ways as you ask the question. Number one, these groups, these regions are trying to get together to create a plan of how we're going to open up the economy. And I understand the desire to have a plan because we already have a plan. As you recall, I mentioned, and when we rolled out here the middle part of March, we said we have a plan, the most comprehensive plan of any state in America today, and that still remains true. It had 3 phases to it. Urgency, which is the phase we're in now, towards the tail end of it, I hope. Then the next phase is stabilization, and the next phase is recovery. We're moving in that direction. Again, the data drives us and shows that what we've put in place during the urgency phase is working to bend the curve and to slow down the spread of the coronavirus. So that's good news for all of us. And so now as we incrementally move to the stabilization phase, we'll have maybe more on that in the next day or two, maybe as soon as tomorrow. We're going to go to kind of our stabilization phase, urgency into stabilization transition, and really kind of have a Utah Leads Together 2.0 plan. It's a dynamic plan we put in place, and we have the ability now to utilize that as we move into the second phase of stabilization. And then over a period of time, if the data continues to drive it, we'll get into recovery. That's when we're kind of back into where we were before, at least as far as access and the economy opens up and we have opportunity to let the marketplace thrive. So stay tuned. Again, the good news for all of us is that we have a plan. We don't have to get together and organize or with anybody else other than ourselves. Lastly, again, I know there's controversy back and forth about what the president can do to the nation as far as mandating to the states. We work very closely with the current administration, and we've had, we meet with them once a week. And not only Republican, but Democrat governors alike have expressed appreciation for the sensitivity to state rights that they've in fact shown. I certainly uphold that. I'm a 10th Amendment guy, and powers not given to the federal government under our Constitution remain with the states and the people. So we have a responsibility as the United States of America, as sovereign states, to find our own ways to resolve some of the issues. But it's a partnership. The federal government is partnering with the states, and together we're going to get through this. They're providing resources and monetary help to help on all sides of this equation. And I appreciate them stepping up. The policies will be put in place mainly by the states and by the governors. One last question.
Governor, a lot of people are wondering, what is life going to look like after this is all over? How are things going to change from schools to everyday life? From your unique perspective, you know, being the governor, the leader of our state, how would you predict life will change for, I guess, everyone from Utah across the country, but I guess specifically in our state?
Well, thank you. That's a tough question because my crystal ball is not functioning very well. And a lot of this is kind of crystal ball gazing. I quoted my favorite philosopher before, Yogi Berra, former catcher of the New York Yankees, who was a great philosopher, and said, I hate to make predictions, particularly about the future. And so let me just give you what I think is a likely scenario. One, we will recover. I'm confident that over the next few weeks and few months, we will get back into recovery. And hopefully by the end of the summer, we're in full-blown recovery. But recovery will look a little different. I think there's going to be a need for places that we frequent to do and go the extra mile to make sure that we feel safe. If we go back to restaurants, if we go to bowling alleys, if we go to manufacturing, if we go to retail outlets, we need to make sure that we feel safe or the people won't show up. So there's going to be more hand sanitizers, maybe more of these masks that we're all going to wear, and that'll be kind of the new fashion statement for a few weeks, a few months, as we all work together to protect the spread of this coronavirus. For those who are more vulnerable, which we'll define as those over 60 years of age, if you have underlying health conditions, if you have pre-diabetic, some respiratory ailments, obesity, those kinds of things, you're going to have to be extra careful, extra cautious. And that'll be kind of the new normal as we, in fact, do those things with a different way in trying to protect our health and welfare. And that will continue, I believe, until and unless we develop a vaccine, which I think we should do. I know I'm talking to the administration about having a Manhattan-type project where it's all hands on deck, and let's see, rather than take a year to 18 months to develop a vaccine, which has been traditional, why don't we do one in 6 months? Let's suspend some of the rules. Let's make this a mandatory thing that we find a solution, the ability to inoculate ourselves against this coronavirus. And maybe other medicines which will help us lessen the severity or the length of time. There's a number of different ways we can approach that. Once that happens, people will have a lot more confidence in going out and resuming activity as we would call normal, what it was like before. But I think we'll find a little bit of a new normal going forth over the next 6 months and maybe longer until we get a vaccine. That being said, there's a lot to be grateful for. We have a land of liberty and freedom. We can go great and wonderful places, certainly just in our own state of Utah, as we start loosening up the travel requirements, which will happen over the next few weeks. We ought to be thankful for all the blessings we have. All the ingredients we have for a healthy economy are still in place. So I think that as we've had a steep decline in the economy because of the COVID-19 virus, we'll have maybe not quite as steep of an incline, but we will have an incline. And hopefully by the end of the summer, we're back in the more robust economic growth and development. And maybe the fourth quarter of Utah this year could be really a great year economically. That's my hope, and that's what I think can happen. So thank you very much. Well, I'll invite Dr. Dunn to come in.
Okay, good afternoon. I'm Dr. Angela Dunn, the state epidemiologist for the Utah Department of Health. Today, we have 2,412 COVID-19 cases diagnosed in Utah. That's an increase of 49 cases from yesterday, or a 2% growth rate. We've tested 46,476 Utahns for COVID-19. 689 of those results came in yesterday. We did have an increase of 12 hospitalizations. So total hospitalizations throughout the outbreak is 213. And we do have one additional death to report today. So we are at 19 total deaths for this outbreak. The additional death is in a Utah County resident. He's male and is older adult who is immunocompromised and passed away in a hospital. So I really want to reinforce our expanded testing guidelines that we announced yesterday. It is crucial for us to understand everybody who has COVID-19, no matter how mild the symptoms. And now we have the capacity in our state to be able to test everybody with mild symptoms. It's very important for the Department of Health to know these numbers because they are what are informing policy and interventions related to COVID-19. So again, anybody who has one symptom of the following: fever, cough, shortness of breath, pain in your muscles, decreased sense of taste or smell, or a sore throat, call your provider or go to coronavirus.utah.gov to find a testing site where you can get tested for COVID-19. We've also analyzed our data by race and ethnicity, and we found that our Hispanic, Latinx communities are bearing a larger burden of COVID-19 compared to others. Approximately 28% of our cases identify as Hispanic or Latinx, compared to they only make up 14% of the Utah population. So we wanted to get this preliminary data out there to you. Our full data set will be available on our website later this week. We know that our healthcare system has lots of health disparities throughout this country and throughout time, and this pandemic is shining a particularly bright light on these health disparities. So we're going to be working very closely with our local health departments and our communities to better understand this disparity and how to best address it, because we are certainly committed to be doing our part to make sure that all Utahns are healthy throughout this epidemic. Okay, I'll take questions.
Dr. Dunn, I'm hearing from seniors who are having trouble getting into their primary care doctors to get that testing referral. And without that referral, they say they're getting kind of bounced around, not getting tested at the clinic or the hospital or whatever. Is that doctor's referral still required And if it is, does it need to be? I mean, is there anything that we can do to make this process simpler, especially for the seniors who are not going to be going onto the website, they're not internet connected? How can you kind of address some of those challenges for the senior population?
Sure. So I know our healthcare systems such as Steward, University of Utah, and Intermountain, they do have drive-through clinics where they allow people to get assessed on site. So that's certainly an option for all Utahns, especially seniors. Our testutah.com sites also don't require a provider referral. So currently those are operating in Orem and Provo, with other ones standing up here shortly. So there is no provider referral needed to go to one of these drive-through sites. They can be assessed on site.
Are there a lot of those drive-through sites? Like the folks I'm talking to now are in Davis County.
Yep.
Or they have one of those close by?
They do. Intermountain runs one in north of Salt Lake in the Davis County, Weber Morgan area. So they're definitely available.
Okay. All right. Thank you.
Sure.
Yes, Dr. Dunn, with regards to disparities, there's been talk in the news about the reason is because of institutionalized racism, but from my understanding, the only thing we could do as all individuals, regardless of your race, was basically to stay home and self-isolate. So I guess with that topic, is it kind of like a political football in the sense that people are paying attention to, but at the end of the day, we were all kind of told the same things to do, and some people in some communities have been more successful than others. And in other words, it doesn't really have to do with a disparity from the institution standpoint.
Yeah, so we know from international data and national data that disparities definitely play a part in the burden of COVID-19. If you think about what we're asking people to do, we're asking you to stay at home, not go to work, isolate yourself from others. So the people who are able to do that are people who have money, who have a job that's able to give them paid sick leave to stay at home, and have a home big enough to isolate away from others. So I think our recommendations are definitely preferential to higher socioeconomic status and leave those communities who are more disparate bearing a bigger burden of COVID-19.
Isn't that also the reason to maybe have stricter enforcement with regards to allowing businesses to operate?
So with regards to disparities, what we're looking at is providing breaking down barriers that are preventing people from being able to self-isolate or self-quarantine. So really identifying what is preventing an individual or a community from not being able to stay at home when public health is asking them to do that, and break down those barriers.
Thank you.
Hi, Dr. Dunn. A couple questions. I firstly wanted to ask a couple follow-ups about the death that was reported in Utah County. I think you said older adults. Do you know? Can you narrow that down at all? You know, over 60, under 60, that type of thing.
Sure.
And then
older adult less than 60. Go ahead.
Okay. And then was that death related to any of the outbreaks that are in long-term care facilities right now?
No, this was just an individual who had underlying immunocompromised conditions who passed away in a hospital.
Okay, and then one other question quickly. We noticed that some of the counts for cases on the website with regards to certain individual health districts have gone down by 1 or 2 cases. So I was wondering why that is.
So I'm not sure about those specific instances, but our data is updated regularly. So if our analysts found that it was misclassified, they would have corrected it and it would have updated the entire table. So there is a chance that that might have happened as we're doing data quality.
Okay, thank you.
I'm hearing a lot of people asking questions about whether or not all COVID-19 related deaths are strictly because of COVID-19, or if they just had COVID-19 and may have died from something else, but they're being lumped in as COVID-19 deaths. There are people that have some questions about that. Can you clarify, are all the deaths specifically because of COVID-19, or are they just patients that have it?
No, COVID-19 was thought to have contributed to the death. So you're right, a lot of our deaths, most of them, have underlying conditions that make them at a higher risk for having severe consequences due to COVID-19. But without COVID-19, they would have not died. So it is a contributing factor.
Hi, today's totals for testing reflect just 689 new tests over yesterday's totals. And I'm wondering what, if anything, the state has done to investigate the reason for the low testing numbers, and what answers have you gotten? Because this has persisted for a little while, it seems.
Yeah, absolutely. So it's been several days that our testing counts have dropped. And so we are working actively with all of our testing sites, including the University of Utah, Intermountain, Steward, and testutah.com, as well as our individual providers, to ensure that they are applying the updated, more broad guidance. We're also talking to our on-the-ground public health practitioners who are doing the case investigations to better understand the demand of the population who wants or doesn't want testing. So there are a lot of factors going into this decreased testing rate. We are going to try to get that up because, again, in order for us to have a lot of confidence in our decreasing case counts, we want to make sure we're testing everybody that should get tested, because our policies and our public health interventions are based on these numbers. So we want to make sure that we have confidence and they're as accurate as possible.
What have those providers said is the reason that people aren't getting tested?
So when we talk with our on-the-ground public health practitioners, there is a lack of demand out there for some populations. You know, it's hard because at the beginning of this, we didn't have a lot of testing capacity. So we were telling people, you know, if you have mild symptoms, just stay home and self-isolate because it won't make a difference to your care. And then our testing capacity increased drastically, so we changed our message. So I think part of it just has to do with that kind of disconnect from the beginning of the outbreak when we had low capacity to test, so we weren't able to test everybody that wanted it, and now our messaging has switched. And so it's going to take a while, I think, for that to catch hold and make its way down, not only through the public, but also our healthcare institutions.
Hi there. Yeah, I just have a couple questions on the data on race. First off, the total for the cases on that race data is 2,414, which is 2 more than the state's reporting. I just didn't know, first off, if you might know kind of what the difference is with that too.
Sure. So that table was pulled after we posted the data for the day on our website. So we have data that's updated every hour. So the 2 additional cases will be reflected in tomorrow's update.
And then do you plan to release more data that breaks it down by county with the race?
Yeah, what's hard is that, I mean, it's good, right? We have such few cases in the state, and especially they're clustered in a few large urban areas. So we can't break it down to really small numbers by county. However, we will be posting more detailed data, breaking it down by other races by the end of this week.
Perfect. And then just last question for you. You mentioned that there's some inequities with jobs and people being able to stay home. Do you also see with these numbers some inequitable access to healthcare among minorities?
Yeah, so one descriptive statistic we looked at was access. So are we testing the same rate of people within each race and ethnicity group? We are testing a little lower in our Hispanic population, but not as low as we would have thought. And so it seems like there is access to testing, which is a good thing. However, they are bearing a bigger burden of positive COVID-19. And so the idea there is that we really have to ensure that that community has the ability to isolate and self-quarantine when asked.
Hi, Dr. Dunn. Earlier in the press conference, Governor Herbert hinted that we could potentially move into the stabilization phase as early as tomorrow. And one of the measures for public health characteristics to move into that is COVID-19 transfer rate less than 1 and declining. Is that happening now?
Yeah, so our numbers are certainly showing a decrease in cases daily. With an incubation period of 14 days, we can't really have a lot of confidence in our data until we pass that 14-day period and see that consistent decrease. The concerning part right now for us in public health is that our testing rate has decreased as well as our case rate, but our cases are still 5% of our total. So we're not seeing a decrease in the positives. If we were seeing a decrease in the positives, I think I would have more confidence. So we really are pushing to get more people tested so that we can have a better idea of the true incidence or the true burden of disease out in the state before we start making policy recommendations.
Thank you.
Hi, Dr. Dunn. I have a question about a potential surge in cases that Intermountain talked about today. I'm wondering how that surge was predicted, when it's predicted to occur, and what it looks like in terms of numbers.
So I wasn't aware of the prediction that they made today. I do know that there are several models out there that all have kind of variety of predictions and peaks, if you will. So I don't know specifically about Intermountain's model, but I know that one that was developed predicts kind of a surge in the middle of summer and then potentially again in the fall. With anything model related or prediction related, we try to just use it to help us plan for our resources moving forward and hope that we don't get those surges. But other than that, I don't have any details about the Intermountain study.
Do you have an idea of those other predictions that say it will surge in the summer? How big will they be right now, according to the models?
Yeah, I mean, there's a lot of variety from, several thousand to tens of thousands, but we don't put a lot of confidence into these models because some are helpful, but they all are unreliable because we have such few data points going into them. I mean, this was a disease that was just discovered in November and only entered Utah at the end of winter. So for a model to be very accurate, you have to have a lot of data going into that, and we just don't have that right now.
Thank you.
Yeah, Dr. Dunn, some people are reporting receiving things through the Test Utah site that says that they've been selected for random testing. Is that something that the Utah Department of Health is seeking? And with the increased capacity, are you asking people who may not be exhibiting symptoms but went to this website and say, congrats, you've been selected for random testing, to go for it?
Yeah, so this is one of those partners we're working with to make sure that all of our criteria are aligned across testing sites in Utah. So the Utah Department of Health is recommending anybody with one of the 6 symptoms I listed contact their health provider or go on our website to find a testing location and get tested for COVID-19. Okay, thank you very much.
Thank you very much. That will conclude today's briefing. We'll see you tomorrow at 1:30.